Diagnosing and treating dog diabetes. Please subscribe to our channel and click the notification bell to stay updated on videos like this. According to Banfield Pet Hospital's 2016 State of Pet Health Report, diabetes in dogs increased nearly 80% from 2006 to 2015, rising from 13.1 cases per 10,000 dogs to 23.6 cases per 10,000 dogs. Although diabetes can develop at any age, it's more common in middle-aged to older dogs. Unfortunately, there is currently no cure for canine diabetes, but there is good news: dogs with the condition can live fairly normal lives if the disease is diagnosed early, and they receive daily treatment to control the disease. Dogs can suffer from two forms of diabetes: insulin deficiency diabetes and insulin resistance diabetes. The former of these is type 1, also known as diabetes mellitus, and it's the form dogs are typically inflicted with. It occurs when a dog's pancreas is unable to produce an adequate amount of insulin. This makes the cells in a dog's body unable to absorb glucose, also known as blood sugar, thus starving the animal of energy and damaging organs. Mixed breed dogs are more prone to the disease than purebreds. In terms of gender, female dogs and neutered male dogs are more susceptible. In order to find out if your dog has diabetes, your veterinarian will test him to see if glucose and ketones are in his urine. If both are, the next step will be to measure your dog's blood glucose concentration. A positive diagnosis for diabetes will only occur after glucose is found in the urine as well as at a high level in the blood. The most common difficulties in diabetic dogs are cataracts, a clouding of the lens of the eye, atherosclerosis, a hardening of the arteries, kidney disease, retina disease, or nerve disease. If your dog's blood glucose levels rise above the recommended normal level, above 200 mg per deciliter, hyperglycemia can occur. This can lead to ketoacidosis, which is a crisis condition in dogs. Symptoms of ketoacidosis include excessive intake of water, frequent urination, decreased appetite, lethargy, vomiting, or even coma. Many dog owners will notice symptoms of the disease before bringing their pup to a veterinarian. They include increased thirst, increased urination, increased appetite, weight loss. Dogs with prolonged inflammation of the small bowel, Cushing's disease, or an extended use of progesterone drugs or steroid drugs are at increased risk for diabetes. Excessive weight can also increase the chances of a dog developing diabetes, as obesity causes cells to be more resistant to insulin. After your dog is diagnosed with diabetes, a serial blood glucose concentration curve will be attained by measuring his glucose level repeatedly over several hours. The results will dictate appropriate insulin, dose, and dosing schedule. Most dogs with diabetes mellitus need 2 insulin injections daily. Insulin injections, which are given just under the skin with a very tiny needle, won't be painful to your pup. Although a diabetic dog can go a day or so without insulin without great harm, it should not become a regular occurrence. In addition to daily insulin injections, your veterinarian may recommend that your dog eat a diet that is low in fat and high in fiber. Fiber slows glucose entering the blood, causing your dog to eat less. Dog food specially made for diabetic dogs are available. Consistency in feeding your dog is a crucial component in managing this disease. Feed your dog the same food in the same amount at the same time every day. Exercise can also play a role in managing your dog's diabetes by lowering his blood glucose levels. As with food, exercise should be done consistently for the same amount of time each day with the same exertion level. Overdoing exercise can cause your dog's blood glucose levels to drop dangerously low. Caring for a diabetic dog requires a financial and personal commitment. You should weigh your dog regularly and keep an eye on his hunger, thirst, and urination, which in excess can indicate high glucose levels. After your dog is set in a routine to treat diabetes, the treatment and maintenance costs are reasonable, but the process of determining the disease and any complications that arise can be costly. It is also necessary to work with your veterinarian to continually monitor your dog's progress to ensure that he is being optimally cared for. If you find this video helpful, make sure to subscribe to our channel and get notified for more videos like this. Thanks for watching.